You're listening to Innovation for Alpha, where we explore everything at the intersection of healthcare innovation and finance. Through our discussions and interviews, we keep you informed and educated about healthcare innovations, next-level venture investing, and everything involving the combination of the two.
Hi, everybody. This is Tobin Arthur with Innovation for Alpha podcast. And I'm here today with Kyle Christopher, who's got a super innovative company called MRG. We're going to dig into the company and talk a little about Kyle's background. So Kyle, welcome to the show today.
Thank you for having me, Tobin. I appreciate it.
Well, this is a good follow-on discussion. Kyle and I had a chance to talk last week, and I got to know a little bit about the company, and subsequently have talked to some physicians who know the company and think this is the real deal. Kyle, tell us a little bit about your background, because it's germane to what you're doing specifically here.
Sure. I always wanted to be in healthcare, not more on the innovation side. So I got a degree in vascular, general, obstetrical, and cardiac sonography to start a mobile ultrasound company back in 2006. And it was really to serve rural areas where physicians really don't have the resources to provide these diagnostics. Patients have long commute times because there's not a lot of imaging centers or places for them to get the procedure done. And then we could speed up the diagnosis process and help the primary care, whoever referred to the specialist. And then it helps with the outcomes, because a lot of the times, over 50% of the times, a doctor will order that, and then the patient just doesn't go get the exam, and 2, 3, 4 years later they end up with something bad. So did that, and after that, got into the diagnostic space. I worked with a triple board, John Hopkins trained. He's a PhD in molecular genetics, pathology, and immunology, Dr. Liu. And we actually he built it, but I helped him take it to market. It was a molecular genetics and pathology lab. It's still in business. We have all FDA approved in-network contracts to do hereditary cancer screening, preventative diabetes screening, and then we can do precision prescribing for insulin levels. This is all in-home type of non-invasive testing.
It's very cool. And you mentioned MD Anderson. So obviously you're based in Houston. You mentioned earlier it's a little warm there at this time of year. But talk a little bit about, so that background ties directly to what you have been building at MRG. And you guys have effectively been in stealth mode, but you've been operating this for several years and working out the kinks. Tell us a little bit about the company and what you're setting out to solve.
Sure. About 5-6 years ago is when I really got serious about this business and just the overall, vision and model. But I really started following legislation and new care models and new payment models that starts usually at the federal level with CMS and Medicare, Medicaid, and then usually they'll run for 2-3 years and see how it kind of pans out, and then the payers will kind of follow along. So we have been at this a while, but we started out just as a remote patient monitoring company, and then really saw that when you're managing patients, there's a lot more that goes into, especially patients that have chronic issues, there's a lot more that goes into just managing their biometric data in order to really drive outcomes. So over the years, we've evolved to an integrated telehealth, remote monitoring, principal care management, chronic care management, and transitional care management, which are the 5 main services that are virtual care related, that all have CPT codes. Some of them have 5 different CPT codes or more that you can bill on that specific service. So we built a platform now around all of those different service lines, around the reimbursement guidelines, has a digital footprint and audit trail to track all of the time and billable instances. And then we have an integrated revenue cycle management technology that helps facilitate the insurance verification, the billing, collections, remediating denials, all the back end administrative stuff that has to take place, or you really don't get paid. So yeah, we have a complete solution there. And then before we pulled any of the technology together, we actually aligned it with over 20 different PhD thesis studies on major, not only operational issues in healthcare, administrative and operational, ties to staffing, just fragmented technologies, integration, interoperability, reporting, all these kinds of things. But then you also have the patient side of it. Because if the patients don't do X, Y, and Z that they're supposed to do, then you can't bill. So we started out first as a technology company and realized that if you don't provide the staffing and the IT infrastructure and all the other things that you have to have in place to make these programs sustainable, it just doesn't work long term, and it's not scalable. So about almost 3.5 years ago now, we started our own clinical call center that's all HIPAA compliant. We have all of the IVR, so interactive voice response technologies. It's all integrated into our platform. So all the phone calls are made through that system to talk to the patients, tracks the time, records the calls. And we're able to now really provide a complete end-to-end solution, starting down from the staffing all the way to getting the healthcare organization paid for the services that were rendered on their behalf that they contract us out to do. So we pulled the technology together around a lot of data. We broke all these different PhD thesis studies. We also pulled together a lot of community health assessments, but we broke it all down by vertical markets. So we looked at all the private practice subspecialty groups and what are the problems that an endocrinologist or a gastroenterologist or a cardiologist or even a primary care, what patients are they managing with chronic issues? What are they trying to monitor when it comes to biometric physiological data? And then what outcomes are they tracking? And how are we going to have like a safety net or a filter to be able to be, triaging and monitoring and engaging with the patients that are not compliant, and even the ones that are compliant, giving them a little virtual high five, a little nudge, whether it's good or bad. And then how are we going to really engage with those patients and get them back on track to prevent a chronic episode from occurring. So we got a lot of the data, looked at those different issues by operational administrative and then by the patient facing side, and then pulled the use cases and software requirements or capability statement together, and then started building the technology, and we do it all in 90-day sprints. So we looked at the private practice, your hospital systems, ACOs. We looked at community and private based hospitals, and then really looked at the payment models. You have all of the fee for service, billable CPT codes, but you have this whole blue ocean of value-based incentive programs, and now even primary care first, it's coming into effect this next year. So we built the program so that it's payment model specific as well, to serve both of those needs, and then really looking at how are we going to be able to integrate into things, right? So FHIR technology, which is the new kind of standard, and being able to integrate into all the different EMRs so that we can make sure and push and pull the data, from point A to point B, so that the doctor, when he gets involved or she gets involved, has that information that resides in our system and their system as well, whether it's the notes, the vitals, biometric or physiological questionnaire surveys. We do summary reports each month. So yeah, there's been a lot that's gone into building it, and not just being the technology, but also providing the service. Another thing is looking at the geography that you're serving, right? When we pulled all these community health assessments, we looked at rural, urban, and metro, right? They're all trying to solve the same problems, but there's different issues that fall in those different areas. So looking at that and taking that into consideration as well is something that we really did.
So there's a lot there. Let me unpack that just a little bit, because you're essentially describing in part the complexity of the system and the complexity for providers in managing all this. So correct me if I'm wrong. What I've learned that you're focused on is you're going to take the chronic care patient load off of a physician's plate. You've got a streamlined system or an efficient system to manage those populations. Again, whether it's rural, urban, anywhere in between. It's good for the physician, A, because they're providing better care at the end of the day. B, they can actually profit, or there's financial viability in this for them. But you guys are managing that and owning that. Am I characterizing that appropriately?
Yeah, I mean, you hit it right on the nail. Like, a doctor has thousands of patients in their EMR, right, or practice, and they just don't have the time. If they're not seeing 30 to 40 patients, then they're probably not, making ends meet, or they're not, meeting profitability with regards to, the unit economics of their business. And so we're with these new care models, all of the CPT codes are time-based. You have to spend at least 20 minutes per patient per month or you can't bill. And so where are they going to have the staff to do that? Who's going to train those people? I mean, who's going to train them on the communication skills that they need to be able to relay these messages and take these patients through these care pathways? Are they going to have the phones lines that they need to make all these calls? When patients call back, that front desk phone is already getting blown up. You're going to want to get it blown up more, right? So we look at all these different things that we learn through things not working, and then we build the solution and bridge the gaps, fill the needs based on our learnings. And we do this in 90-day sprints. So every 90 days, it's another sprint. And it's not only starting with the patient, because if the patient doesn't have the adoption and the adherence and the compliance, we don't have a business, right? And then from there, we look at our clinical call center needs. Like our staff tells us, oh, we needed this or we need that, and we build it. And then we look at the physicians. The physicians really aren't involved that much. The only time they get involved in this is if the patients are compliant 3 times within a week. We then escalate those charts. Each health navigator has 250 patients. They triage those patients, do their chart reviews, manage the escalated charts or the alerts that go off. And if they're not compliant 3 times within a week, we escalate that chart. And that doctor either designates someone within their office to facilitate that escalated chart, or they do it. It takes 2 to 3 minutes to just review and message us back what they would like, how they would like us to handle that case. So yeah, the physicians, this is something that the payers have got behind to incentivize the doctors to leverage and adopt these technologies and care models to prevent patients from having chronic episodes and ending up in the emergency room or a hospital admission. So that's really all we're doing at the end of the day. It is a lot, and I say that's all we're doing, but when you look at it, we're tracking biometric data, vitals, physiological symptoms through our symptom survey engine, the patient's medication compliance, and then we have disease and social determinants of health, specific health assessments, risk scoring, so we can stratify the risk and score the patient, so we know who to really, I don't want to say prioritize, but who we need to focus more on. And then we are able to really, at the end of the day, just totally track and measure specific outcomes. And based on that, we're having very, very high success with over 90% adoption rates, 80% compliance of patients. 8 out of 10 patients are doing what the doctors asked. And it's because we personalize this around all of those things that I said, their day-to-day schedule, their social determinants of living, of health. And then we really, we have less than a 5% churn. So they're staying on for months at a time.
Those are incredible numbers. And clearly you're doing something right. So if I'm a physician and I'm hearing this, and this sounds compelling, you're hitting a lot of buttons that are probably sore spots with me today. What does it look like if I say, and I got to get partnered up with MRG? You guys come in, you're going to look at their patient panel through the EHR records. And you've explained to me too, you don't own the patients, you're partnering with the provider. And so ultimately they remain in control, but kind of walk us through, what's that look like over that, 90-day onboarding period?
Yeah, and I did the math the other day. We're actually going to make like a little insert on our marketing cloud. We don't have a sales department right now. We're just in stealth mode, but we got tens of thousands of patients using the platform. So we're doing something right. But I was doing the math, and we actually invest about $200,000 in these private practice doctors and even health systems. They obviously have budgets and more resources, but over $200,000 in the first year to partner with them. They have a huge asset that they're sitting on, and it's data, it's patient data, right? They worked so very hard to build their practice and to, acquire these patients. And they don't teach you sales and marketing and how to build a business in medical school. I don't think. I didn't go to medical school, but from what I've heard, they don't really teach you much of that. and so we really help drive patients. We help re-engage their patients. We're like an extension to their office, and their success is our success. We don't make any money unless this program makes money. So we're very confident and by investing. And how we invest is I mean, there's zero upfront cost. So we pay for the implementation, we pay for the integration, we provide the staffing. You know, there's probably 10 grand just on implementation and configuration and setting all the care plans up and integrating to their EMR. So there's $10,000 conservatively. We do, you know, on 500 patients, you know, at $100 per device, let's just say ballpark, that they have, our devices have the FirstNet AT&T internet. So we have, you know, internet in these devices. So patients don't need to have Wi-Fi or a smart device, and we can still see their vitals. But that's, you know, at $100 each, 500 devices, that's 50,000. So there's 60. We pay our health navigators $20 an hour because we want them to grow within the company and we want them to stick around. So, you know, $15 an hour or $20 an hour times 5 people, you know, times 6, 12 months, there's another, you know, 60 grand. So you add this up over time, and it's our investment. And then out of the revenue that comes in, we don't have a long-term contract. It's a managed services or managed care services agreement. The healthcare organization is contracting us out to provide X, Y, and Z service. We facilitate the revenue cycle management, all of the, you know, care coordination services, everything in between. We bill, we collect, and those funds come in, and then out of that we have a managed, what would you call it, a managed service fee, where the healthcare organization gets about 30 to 40% of the revenue that comes in, and we get the difference to manage the program.
That's incredible. Let's talk a little bit about going forward. You mentioned stealth mode. You guys are coming out of stealth mode. You're going to be building out sales team and other things, presumably. Talk a little bit about what the business looks like, what you anticipate over the next year. From a, you know, you've funded this business to date. You've put a considerable amount of capital into the business. Are you going to be raising capital? Are you going to be adding staff? What does the next year look like?
Sure. So we have a handful of contracts that are in our backlog that we're actually starting to implement now. So we got a few thousand patients that we're needing to onboard and enroll. So I opened up a friends and family round after self-funding and bootstrapping the company from start date. We're profitable now. We got, you know, like I said, thousands of patients using the technology. We opened the friends and family round primarily to get ready for our Series A. We are driving revenue up so that we'll, you know, have 3,000 to 4,000 patients under our managed care billing model, not just the per patient per month kind of software as a service. So under this managed care model, it's a lot more sustainable and more profitable for the healthcare organizations. So we'll do our Series A. I just opened that round up. It was $500,000. Opened it up about 60 days ago. We have, I think, 150 left. Not being super aggressive on it, but we'll close that up probably in the next 30 days. And then within the next 120 days, we're going to raise somewhere between 5 and 10 million. And that will primarily be to get into some other states and to really, you know, just hire some of the right people and bring on, open up a sales department. We haven't had one, so this has all been organic growth, and really, you know, start getting the word out of what we've done and what we're doing and how we're truly serving not only the patients that are in need of access to care, of just resources, people to help them, but also the private practice doctors. They've really got hit hard from COVID and just reimbursement cuts and everything that fell in between over the past 10 years. That's made it harder for them to make profitable revenue. And so this is that time. You know, I tell people this is like the light bulb getting invented in healthcare. I truly think that, and I think it's going to get even more and more aggressive in our favor. They just increased reimbursement rates by about 41% in January on most of these codes. They're doing that because, one, it's working. We prevent people from going to the hospital. That's saving tens of millions of dollars, hundreds of millions of dollars. And two, it's really, they're doing it to incentivize the doctors to adopt this. So yeah, I think that's, and then once we do our Series A, we're really gonna, really start focusing on managed care contracting and things like that.
Are there any, I'm just curious, as you mentioned, expanding in other states, are there any sort of regulatory or filing things that you need to do state by state, or is it pretty seamless?
Fortunately, because we're, focused on the federal payers, Medicare and Medicaid, we have been able to get most of the commercial payers to pay as well. A lot of the regulations are kind of state to state kind of the same. We do have Goodwin Law, which is a fairly large, very reputable healthcare compliance and regulatory firm
Yep.
that has vetted all of our business models and payment structures and contracts and things like that. But whenever we go into another state, we do look at any regulatory with how we have things structured and how the physicians are getting compensated on these programs. At the end of the day, they're hiring us to provide services and they're paying us for those services rendered, and we itemize what those are and those things. So we meet the compliance and regulatory guidelines, and that's a very important subject, and we take it very seriously. And so before we do go into other states, we make sure get things checked out.
Yeah, fair enough. So if I'm a physician hearing this and I clearly am curious, want to learn more about working with you guys, what do I do? Can I go to your website? Is there contact
Yeah,
information?
you can go to mrghealth.com. That's the parent company, medical resource group. We're a clinical call center, services, and virtual care and revenue cycle management technology company. So go to mrghealth.com. There's book a time to just get a live demo or just have a brief call. You can book a call there. I'm pretty active on LinkedIn. I put quite a bit of content on what we're doing. And Kyle Christopher, you can add me on LinkedIn, and it's good to put a face with the name. So message me there, and we can coordinate a time. But I really I can't stress the importance of just if you're seeing patients, if you're in healthcare, if you're waking up every day and this is what you do, you have to look at what's out there. Things change, laws change, technologies advance, and we're truly living in like a perfect storm. Like, it's not that perfect, but it's if you think of what we're doing in our favor, it's a storm, but it's for us, it's a perfect storm because first you had when I went to ultrasound school, there was no biometric sensors, there was no really Apple Watch. You didn't have the internet and handheld devices where they're at now, right? And so that has just evolved. Then you have all these, capabilities with regards to biometric sensors and being able to ingest all this data to make actionable decisions, right? And then you have this new legislation. Back in 2015, you had chronic care management. In 2019, you have remote patient monitoring. Then you 2020 principal care management, and you had transitional care. So these things didn't exist, right? So it's like new business opportunities at the end of the day, and you have to take advantage of it. And there is so much noise in this space. So much. There's definitely not a technology shortage, and there's so much money too. But we have data, right? And in healthcare, I've learned if you don't have the data to back it up, don't talk about it. And we can show you how we're getting these 90% adoption rates, 80% compliance rates, and the numbers are just going to get better. And so it's important to look at what's out there, make sure you do your due diligence, and ask for references and ask good questions, but take the time to look at what's out there and how you can provide your patients with a better experience and things that you can do to optimize your day and better spend your time, right? And that's really what we do at the end of the day, and how we leverage our technology. So that's just an important thing that I think if we can really get people to stop and just take a minute to, and even if it's not us, there's plenty of other companies to go with, but adopt these things, right? So I just wanted to make that point.
No, it's really well said, Kyle. And the more I learn about what you're doing, the more excited I am, because we hear from physicians every day, just you explained. I mean, all the things you just rattled off, there's a lot of opportunity, but it's complex. And physicians don't have time to necessarily, digest it in the way that you have, but also distill it together into a solution. So we're huge MRG fans. Kyle, thanks for spending time on a Saturday sharing the story. We're going to get this out and support you in any way we can going forward. So keep us up to date with anything new that we can share with the network, and we'll look forward to seeing you guys just killing it in the market.
Thanks. I did want to mention we do have we're as I said, coming out of stealth mode, and we have a strategic executive advisory opportunity that we're
Mm,
doing regionally, state by state.
okay.
And so if there are healthcare executives, physicians, physician assistants, nurse practitioners, people that are innovative, that are looking at the forefront of healthcare, we are extending this strategic executive advisory opportunity. So if that's something that you're interested as well, feel free to reach out. And then we have a channel partner and a reseller opportunity coming up as well. So if you're in healthcare, if you're doing other things and you want to get into this space, I'm driving strategic developments. You'd be working directly with me, and it's an opportunity to really expand on what you're currently doing, and get involved. There's all kinds of different ways to get involved. So I'd like to also talk to people about those two opportunities as well if there's interest there.
That's fantastic. Thank you. Well, appreciate your time, Kyle. Thanks so much for sharing, and we'll keep up to date.
Thank you. I appreciate what you guys are doing there at Angel MD, and thank you for your time, Tobin.
Bet.
See you again soon for the next episode of Innovation for Alpha. Make sure to go to Innovation for Alpha for access to prior episode links, show notes, and other valuable resources. This show is for entertainment purposes only. Before making any investment decisions, please consult with a professional. This show is copyrighted by Angel MD Media, and written permission must be granted before syndication or rebroadcasting.